So hey guys, welcome back to my channel. Um, Today we are going to be talking about the factors that can impact on menstrual cycle. We're going to be talking about menstrual cycles, guys. If you're a guy, you don't want to participate in this, you don't want to watch this. That's cool. That's cool. If there's some of you who would like to sit in for your girls and your women and learn a bit more and understand what we go through as females, you are welcome to do so. Okay, so factors that can impact on your menstrual cycle. So, some of us have regular cycles, they can count on like clockwork. Okay, while many have cycles that aren't regular. Um, for everyone who menstruates, there are certain factors that can impact on their cycle. Okay, so it's important to understand that these factors and their effects on your cycle, because it helps you to navigate the whole period of what you're going through. Okay, that way you know what to expect. Just say that. If a change might indicate a change in your health. Okay, so when you know when your menstrual cycle is, what impacts on your menstrual cycle, you would know how to handle certain things around it. So, factors that causes short-term changes. Your cycle may temporarily change after a big shift in your exercise routine. It can change your menstrual cycle. Your weight can also have an effect. Sleep or medication can also affect your menstrual cycle. So there are variations in your cycle if it's your first time or if you are getting towards menopause. Um, if you undergo a medical procedure or experience a lot of stress, that can also affect your menstrual cycle. Now, some factors have more predictable effects. Pregnancy, for example, will pause your menstrual cycle, as a lot of us know. If you breastfeed, you may find that your period don't resume for several months after your baby is born and may remain unpredictable for as long as you are lactating. So when you're breastfeeding, your period is paused as well. If you start using contraceptives, you may see a change in your bleeding or experience spotting, or even your periods may pause as well, depending on the kind of contraception that you are using. Um, some hormonal methods of contraception prevent ovulation, which means you are likely to have a fertile window. Okay, so factors that can cause long term change. The pattern or length of your cycles can change, becoming kind of like irregular or infrequent. So these changes, if persistent, may be a sign of condition like polycystic ovary syndrome, which we call the PCOS. You've got the thyroid problems as well that can affect your menstrual cycle, or you have the menopausal transition as well. Okay, so as you get older and eventually enter into menopause, menstruation stops. If your period lasts longer than expected on a regular basis or become heavy, this may be associated with fibroids. Okay, if if spotting happens persistently as well, it can include vaginal infection, um, or in some cases cancer. So you need to keep an eye on the flow of your blood, the consistency, how long it takes, duration of it. It's things like that. It may be very trivial, but it contributes to a lot of stuff. Okay, so if you notice unusual changes in your cycle, guys, do not wait for anything. Make sure you let the doctor know.
Okay, let the doctor know. All right, guys, once again, we are done with our cover. I hope that helps you out. I hope that helps you out, and I shall see you in the next video. Ciao.